meeting is being recorded.
Good morning, everyone, and thank you for joining us. We're pleased to be able to have the Chief Financial Officer and the in-house counsel for Olympic Medical Center, Jennifer Burkhardt, join us, and also the Executive Director of the OMC Foundation and the Chair of the Red Set Go Luncheon, Karen Rogers, join us today to present on real high-level overview of what's happening at the hospital, first off, and then Bruce will take it talking about the accomplishments and goals of Olympic Medical Center Foundation, and then Karen Rogers will specifically talk about the intention for the Red Set Go Luncheon. So we're really happy to have them. Just a few housekeeping items before we get going. If you'll put your Zoom on mute so that we don't hear any unintentional background noise, that would be very appreciated. And if you have any questions, you can either raise your hand and I'll call on you, or alternatively, we can you can put your question in the chat and you can ask it that way. I like this to be interactive if at all possible. So you know, don't feel that we need to just have presenters and such. So please ask your questions as you go along when there's a natural break in the conversation. I have shared screen, so if any of the three presenters would like to show any slides, you can go ahead and do that. So with that, Jennifer, I'll let you take it away.
Great. Thank you so much, Colleen. Good morning, friends and community members. It's really a pleasure to be able to talk with you about Olympic Medical Center and provide a little bit of an update. And Colleen, I really want to thank you for the opportunity. It's been so great to have these chances to talk on Wednesday mornings with Coffee with Colleen. It's just been fantastic. So I commend you for that. The last time I talked with this group, it was back in September, October timeframe, and we had just weathered a surge. The Delta variant had really hit our community hard. And now we are in the midst of another surge, specifically hospitalizations from COVID, this time being the highly transmissible Omicron variant. And we're looking at a forecast from Dr. Berry, presently the health officer for Clallam County and Jefferson County, that forecasts that we'll actually see the peak transmission in this current surge near the end of this month of January, which would result in peak hospitalizations more in the middle of February. So we may see more hospitalizations over the next several weeks, and we've been in preparation for that. We have been seeing the effects of the Omicron surge for about a month now, and over that time, our inpatient census has been fairly steady in the mid 40s, sometimes eclipsing about 50. Our average daily COVID positive hospitalizations have been around 10 individuals per day. But the rate limiting limiting factor rather has been our staff. And I'll talk about workforce in just a moment, because that's been, as has been widely broadcast, one of the biggest challenges, both at our hospital and across the state and across the country. I did want to mention that we have opened the Front Street Clinic. That was in October, and that is a one-stop shop for our community related to services for COVID-19. So we have vaccination, testing, that is open daily, and it offers vaccines and provides testing for those who have symptoms, those who are traveling, those who might have pre-operative needs for tests. And we have noticed that the wait times have gone up for a while. It was rather significant. You might have seen cars wrapped around that Front Street building as the line for the drive-through grew. So we have been making efforts to reduce those wait times because of the demand as that has increased. Asymptomatic patients, I wanted to let you know, can go inside the clinic because we do have such long lines in the drive-through. If we have individuals who would like to avoid the drive-through, then we welcome them to come in. And we've also employed another strategy of online registration and for testing and vaccination. So that's been outstanding. Back to staffing, as we have faced increasing staffing preclusions, we've introduced quite a few testing options for our staff so that we can expedite their return to work. in the safest way possible. We actually procured more than 6,000 Binax antigen tests just last week. So we're so happy to have those. And then we have reopened a drive-through testing for employees only now at the previous site of our public-facing COVID testing. That's the drive-through on Caroline Street on the east side of the hospital. So we're hoping that those employees will find more expedited testing and be able to return to work much more quickly. The transmissibility of this variant has really affected our staffing. It's led to not only more hospitalized patients, but also our staff being precluded because we ask them not to work under a variety of situations. They can be precluded from work if they're testing positive.
Restroom at the Bellhaven runway 26, which is the main runway at the Fairchild International Airport, is being resurfaced this summer, and then we have a number of environmental.
And then staff are also precluded under other situations. If they're exposed to someone else who's COVID positive, it might be that there's a coworker, a patient, a family member, a person that individual was sitting next to at an event. And the snowball effect has really been dramatic. It resulted in, at one point, just under 150 staff members being precluded, which is just shy of 10% of our total workforce, which is at 1,675 presently. The preclusions have ebbed and flowed a bit, so they vary in number, they vary in terms of the departments that they have affected, the work areas. It's definitely made our employee health department, which has grown, of course, we've had to staff that. It's made them very busy as they've documented the employee statuses, they've done the contact tracing, implemented return to work guidelines. And of course, the standards are changing. We have new proclamations from the governor. We have new CDC guidelines. So it feels as if we're continually needing to be nimble to respond to those. And sometimes these preclusions have left us with no choice than to redeploy our staff to other parts of the hospital. If there are acute patient care needs, we prioritize and we make sure that if we don't have enough employees who are not precluded, then we redeploy those staff and we prioritize in terms of those patient needs. And we have been able to respond very nimbly and very flexibly so far. I would say that's entirely because our staff has shown such tremendous resiliency. They have really been selfless in stepping up to work in areas of the hospital where they might not otherwise be trained, they might not be used to that area. They have covered for colleagues who are precluded or who just need a break, and we're just seeing an amazing effort by our staff. And those employees have been through such a lot in the last 2 years, putting in such long hours and constantly adapting, as I mentioned, to the changing procedures and the guidelines. And we have just found that our community has been so important. Little acts of kindness and patience go a long way with our staff, and we've just tremendously appreciated our community. On the subject of recruitment, you might have seen in Colleen's initial email, we have a record number of posted positions at 236. I did want to mention that in 2021, despite being in the second year of a pandemic, we filled a record number of positions as OMC has continued to be stable and grow just a little bit throughout the pandemic. We filled 811 positions in 2021, which was really a lot of work for our recruiters. And I just wanted to mention that we are focused on workforce development and career ladders for our staff. And that resulted in over 400 of those positions, more than 50% being filled by internal applicants, and then the other half being externally recruited applicants. So we're trying to develop staff, ensure that we're developing those career ladders for them and allowing them to progress. And in the last 2 years, each year, we've added about 50 new employees. I wanted to give you just a comparison that there is a number of vacancies. There are a number of vacancies across the healthcare spectrum, and just locally, Jefferson Healthcare had 117 open positions at the time that I pulled the data last week, while St. Michael's in Bremerton area, Silverdale, had 488 open positions, and Swedish had 1,342. So while our numbers are large and we continue to recruit as much as we can, of course, and devote a lot of efforts to that, there is a workforce staffing crisis across, as I mentioned, the state and the nation, and we're subject to that as well. We do have 72 open nursing positions, and that gets a lot of the headlines because the RNs are very needed at this point in time. And we continue to try to find new ways to recruit for RNs because they really are necessary at this point in time, and there's a scarcity. But I wanted to mention too that we have a lot of career opportunities. So we are trying to get the word out that there are opportunities for applicants who have no healthcare experience. As of last week, for example, we had 40 open positions that require only a high school diploma or a GED. So there are a number of opportunities at OMC, and in trying to care for our community and care for our patients, we need more staff. So in conclusion, with all the challenges that we've faced, our community has continued to support OMC in amazing ways, and we are really grateful. The brightest spot probably of all has been the tremendous success of the OMC Foundation. And I really can't say enough about how much our foundation gives back to OMC and contributes to our community. We're really fortunate to have with us today two of the shining stars of the foundation, Executive Director Bruce Skinner and Foundation Chair Karen Rogers. And it's with an amazing amount of gratitude and immense amount of appreciation that I turn this over to that dynamic duo who accomplished so much for our community. And I really thank you for the opportunity to share some information about OMC.
Thanks, Jennifer, and I'll open and then Karen will back cleanup. We weren't thinking that we were going to be able to donate a lot of money to OMC a couple years ago. When the first COVID lockdown happened almost 2 years ago, March, we were looking at it as a severe economic downturn. And when those things happen, usually charitable donations are the first thing crossed out of everybody's budget, and all charities suffer because of that. But some amazing things have happened, and I'll get into that. But to start out, we postponed the duck race. It's normally held in May, and that was our first event after the lockdown, and we postponed it. And then our second event, which is the Sunny Six Killer Celebrity Golf Classic, we canceled it. So our early fundraising efforts in 2019 weren't looking that good. In fact, they were looking pretty terrible. But amazing things happened. And in the last 2 years, we do 6 fundraising events, and I'll get into that. And we also have charitable contributions made to us. And in all areas, all of our events, we have set record amount of net revenues during COVID. And that enabled us, a month ago, we gave $540,000 to OMC, which is the largest single donation we've ever given to OMC in the history of the foundation. And that brought us to, for 2020, we gave just over $1 million to OMC, which is the first time that we've ever exceeded that figure. And the foundation basically, well, we give money on behalf of OMC. And, we've supported the Cancer Center, the Heart Center. Jennifer mentioned the nursing shortage. So we have given extensive amount of donations to the Peninsula College Nursing Program, knowing that that's extremely important to helping to solve the nursing shortage at OMC. So we give to all areas of OMC, to help it achieve its goals. We participate in recruitment because that, as Jennifer just alluded to, is so important to the hospital right now, to all hospitals, but certainly to ours. To share my screen here. The foundation was founded in 1984. As you can see, our mission is simple: to improve the lives of patients at Olympic Medical Center. And all of our donations, we tried to do that. We've given over $10 million to OMC over that time period, but 7.8 million of that has come in the last 10 years. As I said, our largest single donation we gave on December 15th, $540,000. And all 6 of our events, Red, Set, Go, the Duck Derby, Sunny Six Killer Golf Tournament, Hog Wild, Harvest of Hope, and Festival of Trees, have set record fundraising for those events the last 2 years. Our next event is Red, Set, Go, but I'm gonna, Karen will report on that because it's, again, our next event. In May, each year we do the Great Olympic Peninsula Duck Derby. That's our great fundraising, grassroots fundraising effort. There are hundreds of duck races across the country. We are the largest per capita race in the country, and we're the 4th largest. In our best year, we sold 37,000 ducks. So that always raises 6-figure revenue for us. And the great thing about it is it's a lot of people in the community given by purchasing a duck. In June, we will hold Hog Wild. That is a casual event. We hold it each year at least the last several years at Harbinger Winery. It's a barbecue event complete with an auction. And that set a record in 2020. The duck race set its record last year. We are very fortunate to be the recipient of the funds from the Sunny Six Killer Celebrity Golf Classic. As a lot of you know, Sunny Six Killer is the spokesman for the Jamestown Sklallam tribe. And so it's a 3-part partnership of Sunny Six Killer, the Jamestown tribe, and the OMC Foundation to put the tournament on. We get 40 celebrity Husky athletes and to participate in this golf tournament. Set a record at last July. Our Harvest of Hope fundraising dinner for the Cancer Center is held every October. Karen is also the chair of that event. And we set a fundraising record at that event last October. Our funds were putting in a new, the OMC is putting in a new linear accelerator, which is used for radiation treatment, and we are helping to fund that. And then our final of the event of the year is Festival of Trees. And many of you are familiar with that. It's a 3-day event. The big fundraising event is the gala, which is always held the day after Thanksgiving. And our tree auction this year, in the auction alone, we raised $163,000, and we netted almost $200,000 for the event. So it was very successful. I want to turn it over to Karen now. Red, Set, Go is coming up February 25th. This started out as a educational event on women's heart health, which it still is. And we raised a minimal amount of funds when it was first started, but now it has become also a big fundraising event. Last year's event, again, set a record. And so at this time, I'd like to turn it over to Karen to tell you about Red, Set, Go and an accompanying event, the Red, Set, Go Walk, Run, Move Challenge. Karen?
Thank you, Bruce, and thank you, Jennifer, for your kind comments also. First, I'd like to acknowledge Bruce Skinner, his recent induction into the Hall of Fame for the Fiesta Bowl. I think we all need to remember how lucky and fortunate we are to have Bruce, the amazing staff with Jeremy Gilchrist and also George Hill. All of their connections are, you know, I don't use this word very often, but talk about irreplaceable. Those are big shoes, and my hat's off to Bruce. He's just one hell of a guy and a lot of fun to work with. So Bruce and I do have fun. And if we take you to lunch, I guarantee you we will walk out with your credit card or your checkbook. So we look forward to taking you all to lunch as we do good things for the foundation. So a couple of fun things for you. Looking back, 2020, Red Set Go was the only event we had in person, because the event took place February 25th, 23rd, one of those dates. And then the lockdown happened March 13th. And let me tell you, talking about between the impending COVID and a big snowstorm, we didn't know if we were going to pull that event off. But that was one huge step again for this event. This year, we're on our 15th year. It's just hard to believe when this event started off being held at Sunland with maybe, Bruce, I'm trying to remember, I've been involved since it started. Maybe there was 70 people there as we started off this event. And in 2020, the in-person event, we sold 410 tickets. One reasons we moved the event from Sunland to the Vern Burton was capacity. When you have to turn people away, that's not how you make money. And so it was a difficult decision because it had been seated for so long in SQUIM, and you try to balance that PA SQUIM relationship, but we had to do it. And it was a courageous move, but I'll tell you, it's been the best move ever. The Red Set Go luncheon prides itself with having the largest silent auction. Looks like a little mini mall in there with all the tables of over 150 items. I encourage all of you, if you'd like to donate a silent auction gift certificate or item, it's one way to help all our local businesses if we go out and buy a gift certificate. And that's always becomes almost a 200% return on investment for the event. Gift certificates go very well, and it's a great way to help the community from everything from your local fabric stores to every restaurant to gym, everything. So 2020, we had a great event in person. It was bursting with laughter and bursting with information, and it's an amazing gathering. And then 2021 hit, and so we had to become the kicking off the virtual events, and we pulled it off. We feel like we're a little broadcasting agency now as far as what we've been able to do. And it once again, the generosity of the community was unparalleled as far as what happened. And people still dressed in red. They still picked up their food. They still participated. And it's a great thing. I look back and at Harvest of Hope in 2019, I believe, if I get my years, it's kind of a fog here. 2019, Harvest of Hope started. We kicked off mobile bidding. And we kicked it off completely just cut dry, no dress rehearsals. We just went for it. And looking back, had we not been innovative then to look at mobile bidding, we would not be as successful today with all of our events by having the ability of mobile bidding. And why is that important? Because people can be at their home, they can be at their office, and they can still participate and they can still donate. And I will tell you, as much as, there was some complaints about mobile bidding and not having the old-fashioned bid sheets that you'd run up and place your bid on an item, I'll tell you, best thing we ever did. And who knew that we would be in a pandemic for 2 years? And that's been a key success to the foundation. I'd like to highlight one other thing that I think is very important. We also have mentored many of our other fellow nonprofits on doing a hybrid event, doing a full online event. We've had them sit in and watch us participate. Jeremy has been amazing to help them through the software challenges. And I think that shows another piece of good stewardship and good leadership, that we all share our successes so that we lift all the boats with one rising tide. So that's been a privilege to be involved in. I think I participated with Bruce with both the Faro Marine Life, the Symphony. Gosh, there's another one. To some extent, the Boys and Girls Club. I mean, we've all pitched in to try and help all of them continue their fundraising during these challenging times. In 2021, we decided we needed to do something with Red, Set, Go. And so we added we talk about heart healthy. We talk about being responsible about your physical well-being. So we kicked off a walk, run, move marathon, meaning you can swim, you can tap dance, you can kayak, whatever it is. The whole idea was to get out and move. And let's just face it, after being locked up for winter as it is, we get tired of shoveling snow for our exercise. It went extremely well. And so once again, we will have both a hybrid. You can do it by yourself, virtual, or we will have an in-person run on Saturday, the 26th of February after the event. And Straight View Credit Union is our race sponsor. We'd like to thank them very much for that role again this year. We pride ourselves that our swag bag giveaway will have amazing items in it that are donated again from generous donors and Straight View Credit Union. So it's a great event. Again, you can do any kind of moving exercise you would like. And it's been extremely successful for those of us that are non-marathon people. That would be me, unlike Bruce, who runs all over the whole world. It gives you an opportunity to do what you do and still participate and get that medal across the finish line. So I'd encourage you to sign up for that. We'll be happy to provide all that information with links and flyers and PDFs for you. And so then let's talk about the luncheon. It will be a hybrid event. We are planning an in-person event and also a virtual event, which will be broadcast on Facebook. It is our hope that Mr. Omicron needs to go away and never come back again. We've all had it. It needs to go away. It needs to scat. It's caused enough chaos. So we're fingers crossed, hoping that this peak happens and dissipates as fast as this miserable thing came in. We are hoping to have it in person. But we also want to make those arrangements to accommodate people who are not comfortable yet to gather. So it will be broadcast online also. Once again, we are reaching out to all our sponsors, both to host the event and then also for the donations for the silent auction. We're very excited. Again, OMC is raising the bar. The Heart Center is looking at a new technology for small mini pacemakers that we will do the fund and need item for. This will enable the hospital to participate in about 35% of pacemakers to be medically placed here instead of all of us going to Seattle to our favorite Swedish or Virginia Mason. So once again, hats off to OMC for taking the technology leap and making a service here available that keeps us off the roads to Seattle and helps our community here. So again, it's a luncheon that we'll have a cardiologist come from Swedish, which is always amazing. We have an amazing survivor this year. You probably all know her, Julie Hatch, and she will be our survivor speaker. And so we would welcome you to sponsor, to donate. I'm not shy to ask for the money for the foundation. I believe in OMC wholeheartedly and what it accomplishes. I'd like to thank our OMC board members that are on this call today. It's an amazing group of people that make this happen. It's not one of us. It's not two of us. It's an entire team of dedicated, selfless people that truly make amazing things happen so that we can turn around and give that $1 million right back to the hospital. And we have been very fortunate with that. So we invite you for an amazing lunch. And Chestnut Cottage will be the caterer for the event. We've done our job this last several years to make sure all of our local restaurants have had an opportunity to participate as our caterers, again, trying to spread the opportunity for all our local companies. So it's always, we do put a piece of economic development into all of our events. So I think that's really important. So with that, I would, again, thank you for the time this morning. I'm happy to answer any questions. We have donated, Bruce, I don't know if you've got numbers handy. I'm at a loss. It's over 1.7 million to the Heart Center now, 1.2. I know it's been extremely beneficial, and this has been an amazing event to watch it grow substantially and expand it over all these years, and it's number 15. So with that, thank you so much for your time.
Thank you, Karen. So I don't know who's the best person to answer this about in the cardiology heart health space, but what do we have all the specialists in at OMC or on the peninsula that we'd like to have, or is there obviously our population isn't such that we can have every single specialist here. Is there one that we're striving to attract to OMC?
That sounds like a Jennifer question.
Yeah.
Our physician recruiting has been, it's been amazingly successful, which we're really grateful for. And sort of like the foundation success, I think the pandemic has been so unpredictable that it was a pleasant surprise. So we were able to recruit a number of specialists in 2021. I think the overall recruitment figures were over 20, probably between 20 and 30 physicians that we brought to the community. We started out 2022 with a list of potential recruits in the physician and advanced practice clinician area. And some of those are specialties and they're difficult to recruit for, but we're already seeing quite a bit of interest. Cardiology is one of the areas where we are actively recruiting. There's always been a bit of a need for neurology and some other specialties that are, it's hard to sustain all of those physician practices in our community because we're rural, but we continue to try to bring some of those specialties to the area and then partner with Swedish and Providence, where we have an affiliation with them, a contractual agreement to be able to provide some services. So all in all, yes, we have about 22 posted positions for physicians at the moment and advanced practice clinicians. Last year, we had gotten that list down to 6 because we had been recruiting so heavily and had such a good story to tell in terms of OMC being financially stable. And a lot of healthcare organizations outside of our area had been cutting salaries and putting doctors on furlough. They've been putting a lot of staff on furlough, layoffs, cutbacks, and we didn't do that. So we were able to entice quite a few providers to the community.
Okay, thank you, Jennifer. So I don't know if you have by chance any slides that I'd love to see a graph of how the number of hospitalizations has waxed and waned over the pandemic period. I'm sure, I've heard different things that it's been very high, and I'm just curious if I assume OMC tracks that, but what it has looked like locally and how the Omicron variant has created a spike in hospitalizations for OMC.
I do, and sorry about my comment. I said, I think so. And I do have a number of slides, but I'm on an iPad and it's a little hard to navigate. So I might be able to just send those to you after this talk, if that's okay. We have slides showing in Washington State the number of Omicron hospitalizations, as well as deaths and some of the breakout of the demographics. And then we also have that for OMC and locally. So I will send you some information if it's okay right afterwards.
Great, thanks. And we'll post that on our website along with this recording in case anybody wants to see that. Another question I have is, I've always wondered on the county site, and I don't know if any of you have an answer to this, but on the county site where they track all the COVID cases, there's a really simple line chart that shows West, or it shows Sequim, Port Angeles, and West, and the number of cases in the last 2 weeks and overall. And I was wondering, how do they define what's West? Is West like District 3, the way you define the county commissioner elected positions, or is it anything that's not in the city of Port Angeles going West? Any idea about that?
I'm sorry, I don't know. Maybe someone else on the call does. I apologize.
That might be a question for Dr. Barry or her team.
Colleen, if I had to speculate, it would be it'd be west of the lake, maybe. Kind of as it's defined by the hospital districts, maybe, but it's definitely probably west of Lake Sutherland.
Mm-hmm.
I
Because,
think I remember one of her briefings talking about that.
okay. And so the Forks Hospital, what is their jurisdiction?
Well, they're a public hospital, so they
Right.
have, you mean the geography
Yes.
of
Yes.
where it is? Gosh, I just saw that map not too long ago.
Looks like
Maybe
John
John-
Nutter came off mute.
John probably has it, yeah.
West of Lake Crescent.
Yeah,
and
west of Lake Crescent.
Joyce. So it's largely Forks, Clown Bay, Nia Bay.
Okay.
Yeah.
Mm-hmm.
Because Joyce is in OMC's district.
Got it. Okay. So we're certainly got the floor open if anybody has any questions for our three speakers. Or John, did you want to add anything? And I also saw that Randy Johnson is on. I know he always loves it when I put him on the spot like that to see if anybody wants to add anything. So say poignant remarks right now. Go.
Well, on behalf of the UMC board, I'd really like to thank Bruce and Karen and their team. They are truly what helps OMC go from good to great. We do the best we can with very limited resources. We don't have the luxury of a population that has commercial insurance and that pays really well. We kind of have to work with what we have. About 83% of the patients we treat are either on Medicare, Medicaid, or another government subsidized service that almost all of them uniformly pay less than the cost of care. So we have a really challenging budget and we do really well with what we can. But with Bruce and his team, they're what take us from good, the best we can, to great in a lot of circumstances. Whether that's in our heart center where they raise funds for equipment that we otherwise couldn't afford, to maybe that's up on a nursing floor where it's something simple like a blanket warmer that, from an operational perspective, we can't justify, a nice to have blanket warmer. But, when you go give that warm blanket to a patient, or it might not even be the patient, it might be the patient's family that's sitting in the room with them, trying to sleep in the room, it makes a huge difference. And probably I think the biggest difference has been at the Cancer Center, and the foundation has just been amazing with what they've given to our Cancer Center. Many years ago, the board made a commitment that we are going to, if we're going to have a cancer center, we're going to have a world-class cancer center. You're going to be able to get just as good a care here as you can anywhere on the West Coast. And to be able to do that requires a lot of funding. And thanks to Bruce and his team, they've come through and they've made the difference. We could never do what we're doing today without their help. So on behalf of the whole OMC board, I'd like to say thank you to Bruce and Karen and your entire team.
Thanks, John.
Thank you, John.
Thank you, John.
Jennifer, you made a comment that it's sometimes hard to retain physicians. Is that because just the community isn't what they had anticipated, or is it that there's not enough caseload, or the hospital can't afford their salaries? What's typically the driving force for not being able to retain those physicians when they come to Clallam County?
Thanks for the question, Colleen. I hope I didn't misspeak. I was at the moment that I was answering that question, I was speaking more to recruitment, and I was referring to there being enough patients to support a particular kind of practice. So an example might be rheumatology that we've looked at in the past, and it would be a great service to be able to provide locally. But do we actually have the need? Do we have enough patients to support that practice? So we are always looking at those kinds of metrics. We have been tremendously successful in recruitment, which is what I was pointing out. But I do think that we have kind of normal levels of attrition. And something I would point to is that our attrition is lower than national and even state rates, both in our provider ranks and in our employment ranks. So certainly we see retirements, we see physicians moving on. Perhaps they wanted more of an urban setting, which of course we can't provide. But our retention is really strong. And right now our employed physician numbers are as high as they've ever been at over 120 employed physicians. So certainly we face the ordinary challenges that all of the employers in Clallam County do, but the retention's been pretty stable.
Great. Thanks for clarifying that for me. I appreciate it. Mike McAleer, you have your screen on, or Randy Johnson? Nope. Okay. Or Jim McIntyre.
I wonder why you call on me. No,
Because you're always an inquisitive type.
I'm just kidding. This is a hospital, and instead of a foundation question, Dr. Berry painted a pretty bleak picture yesterday, as was reported in this morning's paper, about the hospital capacity and the Omicron surge, et cetera, and so forth. Anybody, Jennifer, John, whomever, would you care to comment on exactly how the hospital is doing, given the vaccine mandate and the probable shedding of staff who weren't vaccinated and didn't care to be vaccinated, plus the governor's day before yesterday prohibition of non-emergent surgical procedures, which is likely to have a revenue hit to the hospital, and the COVID, all the adjustments that have been necessary due to the COVID Omicron surge. How is the hospital doing? Should the public be aware of anything that hasn't been reported in the paper? When do you see the light at the end of the tunnel, as it were, once the Omicron sort of burns itself out, and then we get ready for the whatever next event happens with COVID? Kind of a complex three-part question.
Well, John, would you like to take that, or shall I?
You can go ahead and start, and I'll clean up.
Yeah, I'm sure that I won't be able to answer all three parts, Jim. I probably can't even remember them all right now, but I'll speak to at least a couple of the points, which is I mentioned the redeployment of staff, and specifically surgical services is an area that we have redeployed because we had already begun restricting our non-urgent surgeries a number of weeks ago. And it was largely due to the spike. I mentioned we've been seeing the effects of Omicron about a month at OMC, a little bit delayed perhaps from other parts of the country or the world. But as we saw the hospitalizations ramp up, we were still struggling with the staffing shortage that we have been facing for nearly 2 years now, and even before the pandemic. So one of our strategies has been to redeploy staff and take surgical service nurses, for example, who would otherwise be performing the non-urgent surgeries, and be able to redeploy those to the intensive care unit or med-surg pediatrics and care for patients on those floors. So that's been one of the ways that we've been able to continue to have stable operations. It's definitely been, you called it a bleak picture that Dr. Berry painted, and I would say it's been very challenging. It's very hard on staff who are working extra shifts, who are trying to keep the hospital stable and functioning and just doing a great job. There's no question that that's a challenge. And I think we all want to know when things will improve. No one expected a 2-year pandemic. So that's been, it's been interesting, and I don't have any predictions on that. On the finance side, I'll just make one quick comment and then hand it off to John, who has a lot more expertise than I do in a number of areas, including finance. But we have had stable financial operations, again, with a number of challenges. There's no question that over the 2-year period that we've had COVID, there have been times that we have reduced the non-urgent surgeries, postponed those, or had to move around scheduling, and that impacts our bottom line. For 2021, we'll end the year probably with just a slight margin, perhaps 1 to 2%. They're still closing the books on that, is my understanding, in the finance department. But much of that is because of, as John mentioned, the foundation has been incredible. We have CARES Act funding and provider relief funding last year that helped to stabilize our finances during times of unpredictability. So no question that there's been a big impact. We continue to just evaluate the non-urgent surgeries. How can we meet the needs of the community? Because of course the patients don't always feel that these are non-urgent. And then finally, I saw a question in the chat on endocrinology, and I did want to mention that that is an area of intense interest for OMC. We continue to look at how to manage diabetes, how to work through the endocrinology challenges that we have. It is an area where we are looking at the demand and also the ability to recruit, but it's a great question and one that is of, again, I would say intense interest. And we're definitely trying to expand the specialties that we can. John?
Thanks, Jennifer. You did a great job there. Jim asked some good questions that don't necessarily have easy answers. Why is OMC being successful so far? I have to give it 100% to the staff. We have an incredible staff that is picking up extra shifts, double shifts, triple shifts, whatever it takes. And it's not just the frontline workers that are picking up all the extra work. It's clear up to our administrative lead team, our CEO, CFO, Jennifer, Chief Medical Officer. We have a lot of weekends where they come in on their weekends to fill up functions. Maybe we need to open when we first opened our drive-through for COVID testing, we didn't have enough staff to do that. So our administrative lead team came in on their weekend to make that happen, to help staff it. So it's really just the dedication of all of the employees. The COVID rush really hasn't been a patient issue for OMC as much as it's been a staffing issue. We've consistently been anywhere from 2 to 8, and we happen to be up to about 10 right now, patients, but that's been very consistent for the past 2 years. 2 to 8, okay, slight bump up to 10. We have the facilities to be able to take care of those people. They're very labor intensive, but we have the resources to take care of them. What we don't have is the staff. What the big challenge right now is so many of our staff members, those frontline workers, they caught Omicron themselves, or they have family members that have tested positive. And so our big challenge right now is finding the staff. I was talking to our CEO late last week, and he said, we're working on our staffing models. He says, for the emergency room, we only have 2 nurses available on Saturday night, and that's obviously not enough to run an entire ER. So our challenge right now is staffing, and for those that are able to get to work, my hat's off to them for doing what they are. Financially, we're stable. We've got some very generous grants from the government that have kept us afloat. They haven't made us rich by any means, but they've at least kept us at maybe a break-even spot. So we're doing okay, but 100% of the credit goes to the staff that are there on the front line doing it every day.
Great. Thank you, John. And Kay had a question.
Yes, I wanted to say I thought the drive-through addition was really innovative and works really well. I feel sorry for some of those people. It gets cold and windy there. But Jennifer, I had a question for you. I've been hearing a lot about traveling nurses, and can you speak to that and how that works? And are there traveling all kind of medical professionals? I'm curious about that.
Yes, great question. And it follows on Colleen's comment in the chat. Thank you for that. We have a number of travelers on site, and it's been something, frankly, that we've relied on as a pipeline for nurses, but you asked about other healthcare professionals, and we do presently have travelers in a number of areas, including respiratory therapy and physical therapy. These have always been hard to recruit positions just because they do require specialized skill and training. And so it's always tough to get those highly skilled trained workers in our workforce. But during the pandemic, of course, it's been exacerbated. So we presently have between 20 and 25 nurse travelers. And one of the challenges is, and this is reflected in Colleen's comment, is the expense related to those travelers. the travel agencies have noted the staffing shortage, and the prices have definitely escalated, and we see hourly rates. Colleen mentioned $200 an hour. I don't think our hourly rate is quite that high, but it is definitely higher than it should be, and we pay a premium for those travel services. But when we're trying to provide patient care, it's just been absolutely essential. One of the topics with our finance department is just how much those purchase services are in terms of the overall impact to our community. It would be better for us to examine some of the causes of the staffing shortage. And so we've really been working with Peninsula College, was mentioned by Bruce as one of the recipients of funds, and certainly a lot of efforts on our part to recruit not only from Peninsula, but we've been working with other colleges in Washington State. Our recruiters have gone to Gonzaga, they're going to UW soon, and other places, and really trying to bring in more students. We're going to hire a clinical student coordinator relatively quickly here in order to bring more students in as they're experiencing their practicums and other parts of their nursing education, and other healthcare workers as well, and just really trying to be innovative in solving the staffing crisis so that we don't necessarily have to rely on travelers as much, because it's a difficult way to run a hospital. Although I will say we've been very grateful for our travelers, and the staff have embraced having help, because it's been desperately needed. As John mentioned, sometimes we have a handful of nurses or less. We have nursing directors who come in regularly and work the midnight shift because we just don't have enough hands on deck. So we are grateful for the support and having, some pipeline to turn to in terms of the traveling healthcare workers.
Thank you.
Great. Thank you, Jennifer. I posted a question, and then Jim McIntyre provided a response about the 250-yard ruling from CMS as far as the lawsuits that the reimbursement rates were much lower for Medicaid and Medicare. I may have gotten some of these details wrong, but I know that the hospital was part of a joint lawsuit. And Jim says that it went to the appeals court, and so yep, DC Circuit Court of Appeals ruled in favor, and that President Biden's administration decided to let their decision stand. So does that mean the fight is over, or is there potentially a next step?
So I can speak to that. The next step is working with Representative Kilmer. This is one of his top priorities, is to work on this issue, but we're not going to win this one in the courts. We tried, we got an initial win, and then we lost. And unless the Supreme Court changes their mind, the legal process is over for this. So we're just going to have to live with it for right now. Hence the article on the front page of today's Peninsula Daily News. As a hospital, we're looking, we're going to be acquiring the central service building from the school district. That's going to give us office space to be able to relocate administrative functions out of the hospital to open up spaces, whether it's, in the hospital itself or buildings around the hospital. We really need to focus on our hospital campus. And that's how we're going to have to deal with it for now until we maybe get a legislative fix going in the future, because it's truly bad policy. And Derek Kimmler will be the first one to get on a soapbox and tell you what bad or how bad of a policy it is. I mean, there's no reason we shouldn't be able to provide outpatient services in Sequim for that community without a financial penalty for doing so. So that's kind of where we stand on that. And then I see Debbie had another question because of staff, or regarding staff lost to the vaccine mandate. I'll let Jennifer jump in here because she probably knows the exact number off the top of her head, but it was relatively few. We by the time it was all said and done, and we gave people the opportunity, there were very few staff lost. Jennifer, do you want to jump in on that one?
Sure, absolutely. One of the things that we did was try to, as John mentioned, retain as many staff as possible. Of course, with the vaccine mandate, we were a little bit between a rock and a hard place because it was the governor's mandate at that point, and staff who had concerns about it, we couldn't really address that. So we were working strictly within the confines of the mandate, but we did have an exemption process pursuant to the mandate, and we were very careful in that process within administration and human resources, and we granted a number of exemptions. But those staff who decided to leave on their own and didn't tell us, we weren't able to track, although we asked staff to let us know if the vaccine mandate was a reason for leaving. But when all was said and done, as John mentioned, it was very few. Those who actually listed the vaccine mandate as a reason for leaving the organization, it was fewer than 5. As I recall seeing, and I asked to see every, we have a personnel action form that would document that, and I saw no more than 5. We did have, oh, Debbie, you have great questions. The retirements, we are tracking retirements, and we had expected there to be, because of our multi-generational workforce issues, we knew there would be retirements in this era, and we're watching those. But again, the attrition levels they've not skyrocketed. That would have been something that we were monitoring really, really closely, and we've not seen that. So I'm glad to report that we have some successful retirements, and there might be those who entered retirement earlier than they otherwise would have, but the attrition levels really have not increased at all. One other mention, John's answer was perfect on the CMS issue, and there is one bright spot, although we have yet to see how it plays out, in terms of Representative Kilmer, who's been an amazing champion along with our on this issue. He did arrange for us to meet with the deputy administrator for the Centers for Medicare and Medicaid Services, CMS, Dr. Seshamani, and we met with her about 2 weeks ago. And in fact, she fast-tracked our meeting. We were able to set it up within a few days of planning, and it was virtual. We would have liked to have had her out to the peninsula because we wanted to literally walk her through the SQUIM campus and show her how our services work for our SQUIM community, as well as the entire county. But we were unable to facilitate that, but we had a great meeting with her and really explained. Clallam County provided maps and data, and I feel that there was a full understanding. Whether or not she can change that rule through a rulemaking process remains to be seen, but that would be the Biden administration decision there, where it was the Supreme Court that denied certiorari on our petition to the United States Supreme Court. So that's why, as Jim McIntyre mentioned, the DC Circuit Court decision stands.
Great, thank you. Well, let's see. It looks like Debbie has one last great question, and then after that, I think we'll probably wrap it up since it's 8:59. So she asked, the hospital had to install a below zero degree freezer for the vaccines, and now vaccines are in regular freezers. Why is that?
Gosh, Debbie, you have the best memory to remember back one of my earlier talks. I did talk about the below zero freezer, and we were so happy at the time and elated, in fact, that our director of pharmacy, Karen Bright, had been forward looking enough to get us in line to purchase one of those early on so that we could store the Pfizer vaccine. And we actually were able to get 2 of them and provide one to the county. I don't know the science with the way that that's evolved and the way that the vaccines are stored. So I apologize that I can't really speak to that, other than to say I know that it's not the same as it was at the beginning of the pandemic. Like so many things, it's evolved and changed. And I could certainly ask probably Karen Bright or another expert on that, but I just don't have specific details.
Okay, well, with that, go ahead.
Colleen, could I add one thing?
Please.
I would just encourage all of us. Believe me, we're all cranky. We get frustrated when we can't get a medical appointment, or frustrated when we can't go into a certain area of the hospital or our doctor's office. But we got 2 choices here. We can all choose to step to the plate and make the best of our current constraints of what we have. And I just want to say that sometimes I'm extremely disheartened by the type of social media comments that I see about OMC and the doctors in our community. And I would just ask all of us, when you see that, you might try and educate a few people that just understand, if you talk to your colleagues across the United States and the challenges they're having in their hospitals and their medical community, we are damn lucky here. And so I guess I would just ask all of us to do something of kindness rather than criticism.
Well, thank you, Karen. And with that, I think we will call it a morning. I want to again thank Jennifer, Bruce, and Karen for their insights, presentation, and commitment to Clallam County citizens. So thanks very much, and we'll see you next week.